Good morning. Today we have another one in the series of Cancer, Why You're Not Doomed. It's another show. Normally they're called Sunday shows, but we're actually going to run this 8-part series. Today I'm joined by Dr. Elmar Jung, and I'm absolutely fascinated by the subject we're going to talk about because he's an holistic dentist. So good morning, Elmar. How are you?
Very good morning, Chris, and thank you very much for having me here today.
It's all my pleasure, I have to say. Now, you're sitting in Germany at the moment, are you?
I'm sitting in Dubai, actually.
Oh, in Dubai. Okay, the man gets
Yeah.
about. So you like Dubai, do you?
Well, it's very warm and I like the warmth. Yes.
Okay. I have an ad agency in Dubai. My daughter runs it. It's from my previous life. I spent every month for about 18 months trying to rescue her at one point. All right, these shows basically, as most of my regular viewers know, they're all about providing people with information and most importantly, tips that they can build in perhaps to their programs and increase their personal odds of survival. So it's for very much for cancer patients, but your subject goes well beyond that, I'm sure. So let's kick off with the obvious one. What is holistic dentistry?
Well, that's a really, really good question, Chris, because there is no definition, a proper definition for holistic dentistry. So what I can do is I describe what I feel, feel that holistic dentistry is, the way I do holistic dentistry. And that means to me that we really look at the patient from top to toe. It's not just about not using amalgam. It is about really looking at the patient. What does he present? How is he in his emotional, in his mental, in his physical state? What are the real issues in terms of toxins, in inflammation, in structure, in tooth body connections? In a way, all the challenges that we face from mainstream dentistry to look at our patients from a wider perspective, and then obviously use diagnostics, use treatments that are as least invasive as possible and help them in a way so that they, first of all, take responsibility back for their own health. That it's not about, oh, yeah, I go to the doctor, he prescribes me a pill, and that will help, or go to the dentist and she will then do the treatment and that will cure me. It's about real knowledge and information so that people can make good decisions what is the best way for themselves, so that they also learn to, yeah, in a way, feel more into their body because the body has all the answers.
So what you're saying is this is about the bigger issue of health. It's not just about your teeth.
Oh, absolutely. And that's, I think, the main challenge we have nowadays in not only dentistry, in medicine. Everything is so compartmentalized,
Yeah.
everything is so specialized. So you have the specialist for the lungs, but he hasn't got much clue of the digestive issues. And so what's missing is someone who kind of guides the whole treatment and who has an overview. So that's a big, big challenge having all these specialists. And if we look back in 100 years ago, 150 years ago, or probably not even that long, because I had a GP who came home to us and he knew the whole family, he knew what's going on. So he was kind of involved in our life and therefore was much better informed and could do much better choices in terms what is needed in terms of remedies then. And I think that is where we need to get back to.
I do think we need to go back in time to get to move forward. The reason I actually was really interested to invite you on the show was because we did an interview. I did an interview with Dr. Veronique Desolier, who's in Florida, and she's the breast cancer conqueror. And she actually had a breast cancer 18, 20 years ago, something like this. And she set up this whole kind of mission to help people with breast cancer. And she made a really big thing on getting rid of your amalgam fillings if you have breast cancer. Now, would you like to talk to that?
Well, we know from school that mercury, which is at least half of the part of an amalgam filling, we learned that already at school. That is one of the most toxic elements on Earth. So there's the question, why is it a good idea to put that into an amalgamation and then place it in people's mouth? So it comes into the practice with skulls and bone on it. When we have to dispose of the amalgam that we drill out of people's mouth, we have to dispose it as hazardous waste. So it's only in the patient's mouth that supposedly amalgam is not an issue. However, we know that amalgam releases 24/7 out of the fillings, whether that's a new one or an old one. And so constantly, as a bearer of amalgam fillings, we have a lot of mercury in our bodies. And then depending on whether mercury sits favorably in the kidneys, in the spine, in the brain, in the gut. And if you look at symptoms of mercury intoxication, I mean, you're sitting there for quite a while. So it's very important that we become not only metal, but also toxin-free, and amalgam and the mercury in it, they are toxins.
I actually, my daughter had a brain tumor, as I told you. And literally in the midst of all that, I went and had all my amalgam fillings done in London. And Mike Wilkinson, my then dentist, used to drive around in a white Rolls Royce, and he was dentist to the stars. And he said, you've kind of, this was 21, 22 years ago. And he said, you've kind of come to the right place, Chris. He said, because I can do it. He said, most dentists cannot take the mercury out without spreading it all over the place. So talk to me about the challenges. How do you get by the challenges?
Well, it's very, very important that it's done properly. And your dentist at that time was definitely a very, very forward-thinking man. Because if you just drill the mercury out, you produce so much vapor that you really put a shock to the system. So therefore, it's important that you have a special protocol. And the International Academy for Oral Medical and Toxicology, they provided a script, a protocol. It's called SMART. That stands for Safe Mercury Amalgam Removal Technique. And so patients and dentists can have a look what is necessary. So of course we need to protect the patient. So patient is fully covered, the head is covered, the hair is covered, the full body is covered. And then the area where we remove the teeth, that is covered, what we call a rubber dam. Then we have a special suction, a cover-up suction it's called, where whatever we drill it straight into the suction. And then it's also important that we don't just drill out the amalgam filling, but that we kind of cut it out. So what I do, we'll cut alongside the margin of the amalgam filling and the tooth. And then oftentimes we can flick the amalgam filling out, which produces far, far less vapor, and obviously also then far less what people can inhale. Then on top of that, patients inhale through a nasal probe, so they only get proper oxygen in their mouth. They have vitamin C infusion running whilst we do the whilst we do the amalgam removal, and we have a special machine, IQ vac, which has like an elephant's trunk that is very close to the working space. So that has a high capacity of filtering the air. And obviously the dentist is fully covered, the nurse is fully covered. We wear these funny masks as if there's a big issue going on. So yeah, it's really, really important to be as safe as possible and remove the amalgam fillings.
Solier talked about the dentist almost being in a NASA spacesuit.
Yes, absolutely. Yes.
And the way she described it, she said, well, it's quite common practice. We have lots of dentists here doing it and everything else. I said, the only problem is you're describing something, that I worry that the average person in Britain can't afford. This was to her. I think it upset her a little bit, the question. But,
well, the point here is, I think, if you look from a health point of view rather than from a financial point of view, then we have so many means where we can say, okay, well, then I'll do a bit less on this area, a little bit less on there, and invest it in my health, because that's the only thing we have. If we don't have health, nothing actually is worth it.
Well, if something's worth doing, it's worth doing properly, I think.
Absolutely.
That's the most important point. All right, so that's the challenges in removal there. And so I can understand that one. The other one she went on about was, what do you call it?
The root canals.
Pardon?
Root canals or
Root canals. That's the word. Root canals.
yeah,
Sorry. My mind
yeah.
went on something else for a moment. Right. Root canals. So tell me about root canals.
Well, root canal is, from a mainstream point of view, the best thing since sliced bread because it's a dead tooth and you can still keep it in the mouth. Now, the real challenge comes when we look a bit closer to that, because what is a root canal treated tooth, or what is a tooth at all? A tooth is a living organ. It has supplies of blood, of lymph, of nerves. And when we kill it, then we have a dead organ in the body. So it's, first of all, I think not a great idea to have anything dead in your body because it starts to decompose. And then all these funny bacteria that help with the decomposing, and they are not really helpful for our overall health, will come to the place and start the decomposing process. Now, that's where the endodontist, the specialist who does the root canal, says, well, we clean the tooth. So yes, he does clean the tooth. However, a tooth has 2 or 3 main channels, and the specialist will be perfectly well trained to clean those main challenges. And that's brilliant. Will be looking absolutely fantastic on the X-ray most of the times. However, that's not all that there is in a tooth. A tooth has 3 to 4, some say even more, miles of tiny little channels, and you can't get them sterile or disinfected. It's impossible. They did studies when they removed the root canal treated tooth and got it through industrialized sterilization and then cut the tooth and had a look. There were still bacteria in there. So that is exactly what's happening in your mouth then. Bacteria will come there, will hide in these areas because nothing can actually get to them. No antibiotics, no homeopathic remedies, nothing can actually help with that dead tooth. And over time, the dead tooth will discolor, which is a normal process when things decompose. And that is only what's happening locally.
Can I ask a question? So antibiotics can't get into a dead tooth. Is it your experience that nothing gets in there, or could other things like artemisinin get in there?
Well, if you haven't got a root canal treated tooth, so if it's still open, you only clean the channels and you do, for example, with ozone, then the ozone will go into all these channels. But you would have to do that continuously because once you stop doing the ozone, then the ozone fades away and the bacteria will come back. So from my knowledge, there's nothing we can actually do to not make the dead tooth an absolute fantastic reservoir for bacteria.
Okay, because from my point, I suppose my number one subject is brain tumors. And there does seem to be a little link between root canals and brain tumors. Is that right?
Yes.
Say?
I've heard of that. Yes, absolutely.
Really, really. So what would you suggest? If someone's got a dead tooth with root canals, would you say have it out?
Well, we always talk with the patient and tell them the options that they have. They can just leave the tooth as it is and see what happens. They can have the root canal with all the consequences which we talk about, and they also get a little documentation about that, how root canals can affect their overall health. And I personally, I would never want a root canal.
You would
I
never.
would never want to have a root canal. If I had a tooth that's
Right.
dying or is dead, I would always want to
I'm,
have that
I'm,
out.
I'm very pleased because I had a bad tooth and they said, oh, it's a root canal problem you've got. And I went, take it out straight
Yes.
away. That was it. Okay, there you go. All right. Another area I noticed when I was trying to mug up on all this was cavitations. Talk
Yes.
about cavitations rather than cavities.
Well, cavitations, and it's good you mentioned that because it's oftentimes it's a bit confused. So cavity is when we have a hole in the tooth, whereas a cavitation is actually a kind of a hole in the jawbone. And cavitations, they appear when, for example, you had a tooth extracted and it wasn't cleaned out properly, or the body was just not capable of healing properly. So then the bone heals around that trauma area and the gum heals. But inside, there is an area with reduced bone density. And again, we find a lot of bacteria in those cavities, or in these cavitations, I should say. Yeah. And nothing, again, whether it's antibiotics or homeopathic remedies, can go through that mucous membrane that the bacteria have created. And so we need to open the area up. It's also called a fatty degenerative osteonecrotic jawbone, which was named like that by Dr. Johann Lechner. And he's one of the best researchers on that subject, a brilliant man. And he also developed this new Cavital machine, which is the bone density scanner. Mm-hmm. So we then need to open up the area, clean it out. And oftentimes when we open it out, then there's oily, brownish liquid coming out. Sometimes it's just a hole. And a lot of the times there's a fatty, degenerative, like a blob. And we get that out. And then we need to make sure that the entire bone is really scraped properly so that there's no soft bone left. We rinse with ozone a couple of times. And then we also take from the patient's blood, we spin it in the centrifuge, get a red and a white blood area. We discard the red one and the white one with a lot of healthy cells to help with the healing. That will then be placed into the area. It's called fibrin-rich PRF.
So the whole aim is to heal the local area where they took the tooth out.
That is correct. However, as I mentioned in the very beginning when we had a chat, it's important that we look at the patient from a really bigger picture. And therefore, before patients with us can have the surgery, we look at all the possible blockages, whether they are on an organ level, whether they are bacterial parasites, or emotional, mental, physical, spiritual, past life. So that will all be looked at, and no one will get a surgical appointment without having had that released, because that makes all the difference.
I agree more. I have a questionnaire.
Sure.
Got loads of questions on it. And I actually break the questions up so people can't see where I'm going. And that's really important. Otherwise, they kind of rig the answers. All right, let's just go to another little area. Gum disease.
Okay.
Now, gum disease, I'm sure you tackle. But gum disease, from the cancer perspective, we know there's several studies out of New York, different places in New York, where if people get gum disease, they're more likely to get liver cancer and things like this. We also know that gum disease, if people have, let's say dodgy gums, they can have fusobacterium in their mouth. And fusobacterium is linked to colorectal cancer. We've also had recently research that gum disease and other bacteria in the mouth can be linked to pancreatic cancer. So how do you deal with gum disease, and how do you make sure it's gone? Or is it something that keeps reoccurring and you have to kind of deal with it?
Well, the point with gum disease or tooth decay is it's not a local problem. It's a systemic issue. And so again, we need to look at all the areas that the patient presents. It's not just about oral hygiene or cleaning the teeth. We need to look far deeper. What's the diet like? How is the gut working? And we know, even from mainstream medicine, they now confirm that bacteria that we have in a gum disease, they can end up in the heart. So, and when we just tick back to the root canals, in root canals, bacteria that were found, you would normally only expect in the latest part of your large intestine. So these bacteria, they just are everywhere. And so it's the old game in a way between Beauchamp and Pasteur. Is it the germ or is it the environment? And so if we just look at the bacteria, then we lose the battle, because we're all full of bacteria. If we hadn't any bacteria, we wouldn't be here in the first place. So it's about creating an environment that there's a balance it's all about finding or creating the balance. And therefore, it's very important that the patient takes its part in it, takes responsibility and looks at their lifestyle, looks at their diet, looks at their thoughts, at their mind. So that we really create a very healthy space in which it's fun to live.
You don't really know how I work, but I mean, basically, I believe that people build a body conducive to cancer over a 6 to 10 year period, sometimes longer. Something tends to tip them over the edge. But basically, what I try and do is I try and build them a body conducive to health. And I am very simplistic. I start with the gut. I literally rebuild their gut, and then everything else follows. So what you're saying is I've got to not just say there's a gut-lung axis or a gut-brain axis. I've got to say there's a gut-tooth axis. Is that right?
Absolutely. Absolutely. I mean, we have the vagus nerve that connects from the brain down to the gut. So we know there's even a pathway there. And if we then look at Chinese medicine with all the meridians, we have the connection between single tooth areas and organs. If you take the front teeth, for example, the front teeth are connected to the kidneys, to the urogenital system. So if we have issues with one tooth, then we also need to look at the consecutive points that run alongside these meridians. And then obviously with the emotion of kidneys, the main one is anxiety, depression, these kind of things. So we really need to see what is going on. And obviously a kidney issue can also cause a tooth issue. So we remove the kidney issue, the toothache goes. Again, we need to look at the bigger picture rather than just the symptom. And toothache, for example, is just a symptom.
So what did, if you like, mainstream dentists think about what you do?
I think I'm bonkers.
They think sorry.
They think I'm bonkers.
Oh, right. Okay. Okay.
Well, yeah, because it's not taught at university. At university, it's this simplistic Western approach, linear. So you have this symptom, then this is probably that issue, and then we'll do that treatment. And we're just not taught. I think we had about 10 hours of nutrition at university. There's no course that tells you about how teeth are connected to the rest of the body. So yeah, dentistry is like the lung specialist is one area of medicine, but it's in no way connected, far less than the lungs or anything else that's below the chin.
Yeah, I think I would say 90% of oncologists haven't heard of me or don't know what I do. And another 10% now, and it's growing, do know what I do. And I'm getting a little bit further. But I do get the occasional blip. I have a lady who, for about a year and a half now, has only been on my program, having turned down drugs and had cancer all over her. And the latest scan showed, or the one in February showed, that the top half, all the tumors are gone, and the bottom half, all the tumors were much, much smaller. And the radiologist did it all with the lady and said, you must stay on the drugs because the drugs are clearly working. And she and her daughter went, we're not on drugs. So that's true story, right? Anyway, they've just had a scan, and literally she has one left, and it's in her liver. And so her oncologist writes to her and says, it is noted that you are using unorthodox medicine from an online. Now, I can't remember the word, but it meant quack. Okay. Yeah. So I know my place in the world. But she's now going to be a survivor. So we just had Sophie True on the show, and she was talking about breathworks, which is something she's very keen on, and breathing properly, how you only use 30% of your lungs, and you don't take the breath in fully, and you don't get rid of the toxins in your body. And so now tell me, I gather that breathing can affect your teeth.
It's so important. And it already starts when the little one drops out of the womb. Are they then breastfed or are they not breastfed? Because if they're breastfed, then that will help them develop all these things like proper swallowing, proper breathing. because, and that's the funny thing with the babies on mom's breast. They're exhausted. They're really exhausted after they drank because they have to work so much. They really need to milk the milk out of the breast. And by doing so, they need to be very active with their tongue. So the tongue has the nipple between the upper part of the on front part of the palate and milk out of there. So this way, the tongue is in the correct position, so the swallowing will be correct, and therefore also the breathing will be correct. Now, if you have just the bottle, then you drown in that. You don't have to work anything, and there's no incentive for the system to develop further. So babies who have been breastfed, they will be developing their jaw bones much better, less likely that they will have to have orthodontic treatment. And breathing, I mean, we do that in our initial consultation and check where the patients breathe. Most people breathe far too shallow. A lot of people can't breathe properly through their nose because they're deviated or blocked. And so we then bring them on a splint therapy where there's more space for the tongue because the tongue is too far back, blocking the airways. And especially when you lie down, that tongue falls even further back. So you're sleeping, your airways are blocked, you start snoring, which means that you don't get that much oxygen into your system at all. So you have a very unrestful sleep, maybe even suffer from sleep apnea, which can become a very dangerous one because at some point you're without oxygen, without breathing for a couple of seconds, and then this deep breath comes again. So yes, I totally agree with this lady. It's so important that we look into that and have a really free nasal passageway. And therefore, it's so important to look into breathing.
Okay, right. Now, what I'm taking out of this is we're talking about all the problems that can occur. So for people watching this show, because I get the daughter on or whatever, not just mum, for people watching this show who haven't got cancer, how important is prevention and what can you do about it? I mean, prevention, i.e., having good teeth from the outset and keeping them well. What can you do? Give me 3 things that Joe Blogs can do to not have any of these problems.
Well, I would actually start a little bit earlier than before we come to this world, and that's for mom and dad when they want to conceive, that they get rid already of their amalgam fillings in a safe way, because moms during pregnancy and breastfeeding, they will give to their unborn and later with breastfeeding a lot of their toxins to the children. So that's why we find a lot of babies, young kids that don't have any mercury fillings in their mouth with a high load of mercury. So that's already the start. If they get rid of their mercury, then the kids will also be mercury free, especially if they also do detoxification. Then when they come out, have the breast as a method of feeding for at least 6 to 8 months. And then obviously look what kind of toothpaste we're using, fluoride-free toothpaste, do a proper oral hygiene protocol, introduce that very early, a healthy diet, a good mixed diet that feeds the child very well, keep away from sugar. So these are the basics for kids, because if you don't feed kids sugar in the very early stages, they're not really attracted to that. Sugar is an addiction and it should be banned like tobacco. So that's in the very early stages. Then the next step comes when they go to the dentist and the dentist says, well, your teeth are a bit crowded. We have to wait until you're 13, 14 years old, and then we give you braces. Well, what they do then, they rip 4 teeth out to create the space and then collapse the whole system together with metal wires. Now, what we tend to do is, if there is an issue, we start looking at that when the kid is 5 or 6 years old, because then we can actually use the growth of the little one to enhance the jawbone development. And therefore, it's very little risk that they will end up with fixed braces when they're 13, 14 years old. Yes, it takes a bit longer and it requires quite some motivation from a parent's point of view and perseverance from the child point of view. However, that is a natural way of really getting the child with a nice dentition and a nice bite.
Okay, all right. You mentioned the word fluoride.
Yes.
I was brought up in Watford, and it was one of the 4 places in Britain that had fluoride in its water. Tell me the dangers of fluoride.
Well, they use fluoride in concentration camps to docile the prisoners. And if we just look at water fluoridation, we don't know how much fluoride people are taking in through their diet, through drinking. So it's a mass medication. And Basel, it was the Swiss city, they had water fluoridation for many decades. And then they had to admit that there wasn't actually a significant or at all a benefit in terms of preventing tooth decay. So they stopped it. And we know the Swiss are very meticulous with their numbers and with everything they do. So I think that fluoridation is a big mistake because we put a toxin into our body which is known to cause all sorts of issues, and it doesn't really prevent what we want to do. If you wanted to remineralize the teeth with fluoride, you would have to keep the teeth very, very dry and then put a gel on and keep it there for a while. And that's, from my point of view, questionable if that would work, because you have the saliva, and so there is never a really dry area. Therefore, all the gel then goes systemically. So my advice is have a proper diet, have a good hygiene and a lifestyle. You do not need fluoride.
Right. I have written on fluoride a lot of times, and I just remember coming across something that said women who are pregnant should not be exposed to fluoride. And you think, hang on, what about all the women living in Watford?
I mean, it's the same thing with everything. It's if you hear, yeah, not for women or pregnant or children. Yeah, okay, well, if it's not for them, then there must be a reason why they say that. So it's just no good for anyone.
Yeah, that's right. I agree with that. So I think probably the final area that you touched on earlier, I just like to ask a little bit about is emotion.
Yes.
Because Sophie was talking to me about breathing and emotion, but you seem to have a view that the teeth can affect your emotions, depression, anxiety, and things like that.
Well, yeah, if we look at what kind of fillings, and we spoke about that, amalgam fillings with a toxicity that can affect the kidneys, for example, and the kidneys are the area of anxiety. So if we have a lot of amalgam fillings, that will affect the other organs. Also, when we have a root canal, for example, with the tooth organ connection, the energy flow from the kidneys to the tooth is kind of stopped, interrupted. So therefore, there's a big issue with those teeth. And I brought that, there's a whole chapter in my book, Shut Your Mouth and Open Wide, where we talk about stories of patients that had their treatment done, and whether that is clenching or grinding, whether that's amalgam fillings or root canals, they all impact us. We are so, the whole body is so interconnected, it just doesn't make sense to even think that what we do in the upper right tooth hasn't an effect on the lower left area of the rest of the body. It can't work like that. We're not machines.
I've got a chap coming on the show in a couple of days' time who's George Cooper, who's a traditional Chinese herbalist, and he does acupuncture and everything else. He's lived in China and everything else. And I will ask him about this, because in the early days when I used to do Cancer Active, if I wrote about meridians and chakras and things like this, I got the skeptics out who would pan me. But in fact, I don't know whether you know this, but one of the biggest users, if you like, of body energy are NASA. And one of the, just a little aside, but one of the big things is that your healthy body when you're standing up is, I think it's 7.5 hertz. But when you're sitting down, you're 4.5 hertz. And NASA has done loads of work. It's all in the Smithsonian on this, because you need a body to be healthy. It must be over 5.5. So when you've got a man in a rocket on the way to the moon and back, he's actually sitting in unhealthiness all the way. And then they've gone on to look at the chakras and everything else. So people can't argue about this anymore. This is proven.
And I'm pretty sure that all these areas like NASA or the military, they are so far ahead of what is actually in the known. So they know all of that.
Yeah, I'm sure.
And I mean, there was even an oncologist in Munich, Gerd Hammer, who brought to life the German new medicine. And he found in his scans of cancer patients that there were areas in the brain that were, well, let's say deformed, and that the cancer, you could then relate one area of the brain to different organs. And so by healing the emotion from that organ, you could heal the cancer.
Yeah, I don't doubt
or
that.
if you look at Dr. Bradley Nelson with his emotion code, I mean, he's talking about similar things.
Mm, mm. I don't doubt it at all. All right. Couple of last questions then. First of all, 3 tips for a person with cancer. What would you do about the teeth? More.
Definitely get rid of all root canal treated teeth, get rid of all the metals in your mouth, and make sure you have a really good and individualized on you prescribed diet.
Okay, excellent. Right, now, how do viewers get hold of you?
Well, they can either go on my website, which is www.dr-elmar-jung.com. They can have a look on Instagram. We're getting better on Instagram and bigger, so we will put more information out there. And if someone lives in the area of Southampton, on Wednesday, the 23rd of November, we give a talk in Brockenhurst. That's the whole team of my practice for the public. So to bring the word out even further so that people can see and can hear what is important, what kind of questions to ask when you're next at the dentist, so that we educate patients rather than dentists, because it's the patients that will make the trend work and will ask the questions. And if they don't get the right answers from their dentist, they might want to move to someone who is more biological, homeopathic, holistic, or integrative.
Right. I found the whole of this absolutely fascinating. I'm sure my viewers have found it fascinating. And so I can almost sense now I'm going to be inviting you back on the show in a year's time, and we'll talk more about it all. But I just, for today, I'd really like to thank you on behalf of myself, but on behalf of all my viewers, for talking to us like this. It's been wonderful.
It was an absolute pleasure, and thank you again for having me on your show. It was really fantastic to be here. Thank you very much.
It was my pleasure. All right, all the best.